My name is Stella. I'm a family physician at Weill, Cornell, Medicine-Qatar. To stay motivated, you need to minimize the things that make you feel tired or bored. Living in a hot country, if we don't drink enough fluids, we get very dehydrated or we feel tired. Two little things: make sure you drink plenty of water. Make sure you don't skip meals, and the most important meal I would say is breakfast, because that really gets the day going. Before you go on and do some sports, have a little protein snack. That seems to really sort of strengthen and give that little boost. Try and pair up with a friend. Nothing is better than when your friend says, "Come on, let's go," and you think, "Oh, I can't," and they pull you along. So it's easier to do it with a friend than to try and sort of drag yourself through it by yourself. Make it fun. And you've probably seen many people who have their headphones on and who listen to music or, sort of do something else at the same time. It distracts them from the actual exercise that they're doing. Invest in whatever else you like. It might be watching a movie while you're on the treadmill. It might be putting your headphones on and, running, or it might be joining a salsa dance group where you love the music, and before you know it, you're actually building your skills and you're enjoying yourself. Sometimes you can actually go out and buy sports gear that you also feel good wearing and enjoy, using. So make the whole thing become a pleasure, and that kind of helps motivate you, keep the motivation going. If you're sitting on a couch and you say, "I can't move," if you actually bother to put your trainers on and put your clothes on, we have mentally, trained ourselves to associate ourselves with certain things in certain clothes. That might help to edge you on to actually get going. It's very important, whatever activity you do, you're mindful of two things. It's not just the cardiovascular fitness, so how fit you are in running, jumping, whatever. It's also your muscle tone and your strength. So any exercise you do, think what's going to make me cardiovascularly fit, and what's going to be the resistance or the muscle tone exercises that I need to do. If our posture, if basically the skeleton is strong, it protects us from injuries. Don't just focus on the cardiovascular fitness. Make sure you also look at the muscle strengthening exercises as well. Most of us, once we hit mid-30s and 40s, we start to actually lose muscle mass. So it's really important. Don't assume that it only happens to very old people. It happens early on in life, and that needs to be a priority. Exercise as medicine is really plays the role of, therapeutic role, where it actually helps to fix the system or the part of the body that's been injured or has been essentially out of action. So for example, if someone's had a heart attack and they've been in hospital, they will have to go through a specific cardiac rehabilitation exercise fitness program. The same may apply if you have reconstructive surgery for your knee, or if you've had surgery for your back, or if you've been in hospital with a chest injury or something. So those are very different. And again, if you are in that situation, your physician, your healthcare team will give you specific prescribed exercises that you will need to do to be able to regain the fitness that you had prior to the incident. Okay, I'm Stella. I'm a family physician at Weill Cornell Medicine-Qatar. I finish off by saying that always remember to keep your health first.